Good afternoon, everyone, and Brynhawn Da from me over the border in Wales. My name's Laura Thorne, and I am the current chair of the Psychiatric Trainee Committee. And I wanted to welcome you to the event today. It's great to see so many trainees here and welcome you on behalf of the college and behalf of the PTC. I'll tell you a bit more about our role in a minute, but to start off today, we're going to hear a message from our president, Dr. Lade Smith.
Welcome, and yes, you did make the right choice doing psychiatry. I was going to just really talk about a little bit about who I am and the kind of priorities that I think we need to have for mental health and mental health care, above all for psychiatrists, actually. So I'm actually a consultant psychiatrist at the South London and Malta NHS Foundation Trust in London, and I'm actually the clinical director for the forensic services there, and I'm also a visiting senior lecturer at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. And as I said, I've recently, just since July, 11th of July of 2023, I took over as president of the Royal College of Psychiatrists. And in fact, until July, I was actually the clinical and strategic director of the National Collaborating Centre for Mental Health at the college, and that's the NCCMH. You probably used guidance from the NCCMH, because the NCCMH is the body that provides NICE guidelines and writes NICE guidelines and things like that. And I was involved in providing medical leadership for the team, and I also sat on the core working group of the Independent Mental Health Act Review that was chaired by Professor Simon Wesley. And I'm not going to pretend it was a massive surprise, but a real privilege taking on the the role of president, actually, of the Royal College. On that note, do keep an eye out for we've got this new monthly question time with the officers, where we'll answer your questions, or you can actually forward suggestions about how to improve things in mental health care, and you can submit those in advance, and we'll have a look at them and we can discuss them. It's only a short thing every month, but what I'm hoping is that gradually we'll build up a really nice dialogue, actually, that will help people to understand and think through how we might be able to do things better. And we're also thinking about doing presidential debates where some meaty topics we can discuss. Actually, could you move the slides, please, for me? Is that all right? Yeah, what is the role of the college? The role of the college is to, it sets standards, promote excellence in psychiatry and mental health care. And I think Ian's going to be speaking. He's going to speak a bit about some of the standards and the exams and things like that. We lead and represent and support psychiatrists, and increasingly, it's really important that I think that we raise the profile of psychiatrists, because if we don't, then other people will take over what they think will tell the world that what they think is important in terms of mental illness and stuff. And lots of people know about, mental well-being. I mean, Gwyneth Paltrow knows about mental well-being, but she doesn't really know about mental illness in the way that we do, because we're the experts. And for people to talk to us about it, and for people to listen to what we have to say about it, they have to feel that we're worthy of listening to. And so we have to raise our profile. We work with patients, carers, and other organisations interested in delivering high-quality mental health services. And we represent the expertise of the psychiatric profession, which is kind of touched on what I was saying before, and that's to governments and other really important agencies who are essentially the decision makers. Now, I don't know if you realise, but it's very much an international organisation. There are members and affiliates all around the world, and we have, I think, 4,000 plus international members, and the latest figures have shown that our membership's grown, so it's reached like 21,000 all-time high. I was going to say something about my priorities. Actually, yes, you can move the slides, please. There's no doubt, actually, that there's never been a time. I've been working in mental health care for 32 years, and there's never been a time like this. There's never been a time when so many people are open to and ready to talk about mental health and mental illness. And so we have to capitalize on that, and we have to be ambitious about what we want to achieve, because now is our moment. So because of that, the priorities that I had, these are the priorities that I stood on for my, the presidential priorities. If you can move slide, please. So first and foremost, addressing the treatment gap. And there's a massive treatment gap, because if we really want to make a difference to our patients, we have to be able to help them get better. But there's a massive gap between the resources that we have. We've been, psychiatrists particularly overstretched and under-resourced, and that's just got worse since, because of the impact of the pandemic, and of course there's war and displacement, and then more recently industrial action, and then the cost of living crisis, and of course climate change. And we know that we do know that we've got good enough evidence to show that if you can treat people, particularly if they're young people, you can actually get people properly well, so they become adults who are able to function and achieve their potential. If you leave it to when people are adults, then they're much more likely to have relapsing, remitting, long-term conditions. And continuity of evidence-based therapeutic care is absolutely central to mitigating this, because we know it's more clinically effective and it's more cost effective. The problem we have at the moment is that the service pressures result in kind of reductive care that forces psychiatrists into being almost like prescribing agents. There's more and more expectation that, we don't do much other than prescribe medication to people. And that's demoralizing. That's not what we're trained for. And we can do so much more than that. We do the depth and the breadth and the length of everything. We can deal with the complexity in a way that other professionals can't. So our patients deserve much more than just prescribing agents. They need really good, high quality care in safe and therapeutic environments. And part of the reason that we're not able to deliver as good a care as we would like to in every circumstance is that because for too long, mental health services have been the poorer relation to physical health services. And that, particularly when it comes to access and even standards for waiting times. I mean, I find it astounding that the time it takes for you to be seen. If you get referred to mental health service, there's no actual standard for how long you could be seen. So one service might see you in 6 weeks, another service it might be 8 months. It's literally it's arbitrary, and it depends almost on the whim of the local service. That means we've got to continue to argue the case for parity of esteem, especially because we know the longer you leave things, the worse they get. And that's just bad for the individual, it's bad for their families, it's bad for society, and frankly, it's quite costly. And when you think about mental health care on a global scale, it's imperative that we move to more sustainable models of mental health care. And that's not just because, frankly, we can see that the planet is burning, but also because it's actually crucial for promoting resilience, reducing stigma and discrimination, helps to improve access to care, and it fosters a healthier and more inclusive and frankly more productive world for everybody. So there's something about not just thinking about, how do we improve our services locally and how do we get funding locally, but also nationally and globally. And I need to tell you that British psychiatry is some of the best psychiatry in the world when it's done well. We've got some of the best standards and the best quality of care. So lots of people internationally look to us for how you might do things well, because when we do it well, it works brilliantly. And that brings me on to the most important bit, which is our workforce. So go to the next slide, please. So a big issue for me is making sure that we nurture and support psychiatrists, because we've got to be able to retain, psychiatrists so that, and look after psychiatrists so that psychiatrists can support patients to thrive and achieve their potential. If you don't have staff who are functioning, then they can't do their jobs well. And frankly, the industrial action is a reminder of what I get told by UK psychiatrists up and down the country, that people feel undervalued, and sometimes they're just not given the basic infrastructure needed to carry out roles. So it's essential that employers attend to the needs of their medical staff, and that's for retention reasons as well as recruitment reasons, because frankly, you guys are extremely highly trained, really sought after resource, and there's other places in the world that would happily take you if we don't look after you. We've also got to harness technology and champion research so we can drive the improvements in prevention and care. And we really want to encourage psychiatrists to feel confident in using evidence-based biopsychosocial approaches, that complex approach that we can do. And that means that people will get better. They'll get better and they'll stay better. And to do that, we also need to make sure that we've got good academic understanding, good research. We need good research. We need good academics who know, who can develop new techniques, new interventions that help people going forward. I mean, you see what's happened in the COVID pandemic, vaccines produced because money was given to the research. See what happened with HIV and AIDS. It's no longer a disease that kills you. And that's because, the research was done and we've got this fantastic findings. And our workforce should be able to access good basic research training so you can support your clinical work. But also, if you want to be a researcher, if you want to pursue academic psychiatry, you should have no problem being able to do that. And in fact, there's been a recent NHS workforce plan, which is supposedly aimed at, it's aimed at building up the psychiatric workforce. So one of the things that we're going to do at the college is to work on that, look at it more closely, because there are some areas that it's a little bit thin on. Look at it more closely and think about how we can work with the decision makers to ensure that practical actions are implemented and to ensure that all psychiatrists of whatever grade feel supported and valued at work. And frankly, if you're not feeling valued at work, we are actually thinking about ways to improve your working lives. So in the next year or so, I'm hoping that people will start to see a difference in that. And then it's fairness for all, and it's been a big area of interest for me, health inequality, and that's actually health inequality for patients, but also, frankly, inequality for staff, because we know that there are significant disparities in mental health need, and they need to be challenged, and that's for ethical reasons, moral reasons, legal reasons, and financial reasons. And we need to be able to scope ways to improve access to mental health services. And we need to influence the key strategic and policy makers, the people who make the decisions about where the money is going to be spent and how it's going to be spent. Even if they don't spend more money, why don't they shift a little bit more to maybe proximal factors and the distal factors that result in mental health problems, because it has such an important impact later on. And then we also need to think about tackling workplace inequality, especially for women, doctors with disabilities, LGBTQ plus doctors, and doctors from minoritized communities, because we know that otherwise people don't thrive at work. So one of the things the college has done recently is launch the Act Against Racism campaign. It was launched at Congress, and it's a really good example of what we should do. And I'd urge you to have a look at it, actually. Everyone should look at it, because it's one of those, it's guidance that provides 15 actions that are doable. And frankly, if you do them, if they're for organisations, they're employers, but it's also information for employees as well. So it's useful, and it doesn't take long to read. But if you do them, if the organisation does them, things will be better for the employees longer term. And it also gives you guidance about what to do if you're a bystander and you witness something, and that's quite helpful. And it was developed with medical directors, with doctors with lived experience, with patients, lots of key stakeholders, like the Race and Health Observatory, for example, and even the Welfare Commission of Scotland. And, we've already got people signing, you've got various organisations signing up, and more organisations signing up. So encourage your organisations signing up. They don't have to pay for anything, but it's just to make a commitment to fulfil to start working on the actions. But we also need to think about patients. I'm going on a lot bit long, sorry about this. But our patients, are people who, we exist for our patients, and we have this fantastically privileged role in which people tell us their most intimate, their most intimate information, and we get the reward of being able to support them. But it's our duty to ensure that all of our patients are properly looked after, and that means, because we're doctors, doing comprehensive assessments to ascertain their mental and physical needs, make sure it's patient-centered care, taking into account an individual's rights and wishes, and use the best available evidence to inform practice, because that's just good practice in medicine. And really everyone, all of our colleagues should be working. And I'd say that, you know, you have seen this, there's lots of activity and lots of work going on around transgender health. And I am aware that there are a range of views on this topic, but I'm also conscious that, so some of you will have heard about stuff that college come out of the college, and there's often misunderstanding, I think, about what the college's position is. But I do need to assure you, and this is because of the, you know, there's massive health inequalities for people, that the college will be updating. It's got a position on it, but it's very out of date. It's going to be updating its formal position on this once the CAS review is published and there's information from NHSE. The update will be focused on oral. That means it will be guided by good medical practice. There'll be very wide consultation. There'll be, you know, be informed by evidence, and that will be all sorts of evidence from lived experience right up to, you know, evidence. And we certainly, you know, it's not going to be influenced or driven by people's individual or, you know, otherwise ideology. And the other thing that we'll be doing is supporting the rollout of the patient and care race equality framework, which is an idea that came from the Mental Health Act Review, worked up by the NCCMH, who I mentioned before, and it's now being piloted in 4 sites in England. And it's a really important, it's a competence framework that again supports organisations to support patients to be able to thrive regardless of their backgrounds, and it particularly focuses on minorised ethnic patients who do very badly in health, unfortunately. So the hope is that over time things will start to improve and they'll get better access, experience and outcomes. And then what can I say finally, together with the officers, so the officer college are the president, the dean, the registrar and the treasurer, and we work with the devolved nations chairs, faculty division chairs, and we develop a college strategy, and we'll be doing that shortly, and that will be helped by our president leaders. Actually, in this next slide, please. And so we now have actually 7 presidential leads for various areas. Raj Mohan and Namrit Sakar, who do equity and equality. Mohammed Al-Uzri, who does global mental health strategy. We've got, for the first time, we've got presidential leads for women in mental health, Catherine and Philippa Greenfield. We've got president leads for compassionate and relational care, Russell Razak, and that's because we keep having panorama programs with people being horrible to people with mental health problems or learning disability. We have a presidential lead for physical health, and that's Ed Beveridge, and then finally one for wellbeing and retention, who's Ananta Dave. And I'm really proud and excited to see the college with our fantastic officers. So it's because everyone works as a team. The college, it's the presidential leads, the vice presidents, the patient and carer reps. We have 200 of them who work with us, the divisions, the committees, the staff members, and there's almost 1,000 psychiatrists who volunteer to support the college and to fulfil its aims and function. And I hope that you, as trainees, will start to get involved in the college. So the college isn't just you working towards your exam. The college is you, and psychiatry will be better for having you fully involved in it. Thank you.
Again, welcome. The rest of the programme is really packed with loads of useful information about training. And please put any, I think Charlotte's put it in the chat, but please put any questions in the Q&A and we'll try and get to answer them. So just to kick off, I'm going to say a little bit about the Psychiatric Trainee Committee and what we do to represent you. So we are a group of nearly 50 elected representatives from across the UK, and each division or devolved nation will have its own representatives on the committee. And we also have some co-opted roles from specialist groups, one of those being an exams rep, another being an IMG rep. And our job is to represent voice of trainees on different college committees and then to relay college information back to trainees in turn. So whilst we don't deliver training as such, we do advocate for all sorts of issues to do with training, and we sit on nearly every committee of the college. So in addition to that, we have projects. One of those is our annual conference for trainees, and this year it's going to be held in Leeds on the 25th and 26th of April with the title Next Generation, and it concentrates on new advances in psychiatry, as well as focusing on career progression and well-being. So it's going to be a really exciting event, and it would be great to see you there. Other projects we've been involved in this year have been looking at study leave and how to improve accessibility, increasing less than full-time representation on our committee, trying to improve exam resources for trainees, and we are involved in co-leading a review on the use of physicians associates in psychiatry. So we have an awful lot going on. We also have Twitter takeovers. The next one will be in March. So we have a PTC Twitter account, so make sure you give that a follow. All of our information about your reps, who your local reps are, or how to get involved in the PTC is on our website. So please do have a look, and we'd love the people to get involved. I'm not going to take up too much more time because we have lots of people here to tell us lots more about the processes of training. And so next, I'm going to hand over to Dr. Mary Barrett, who is our specialist advisor for less than full-time training. Good to see you, Mary.
Thanks, Laura, and good to see you too. I've got some slides which I think are going to be shared for me because I'm slightly technophobic. So I'll just wait for those to come up. But yes, it's welcome. It's really good to have this opportunity to meet with you all and talk with you, albeit virtually, a little bit about less than full-time training. Some of you may be less than full-time trainees. Some of you might be thinking about it. Maybe some of you haven't thought about it, but after this you will. Next slide, please. So the good news is that now any trainee can apply to go LTFT as long as they've got a well-founded individual reason. And, you know, all reasons will be considered, though it has to be taken in the context of the programme and the educational needs of the less than full-time and the full-time trainees. And obviously it's managed by your deanery. I call them deanery, they're not really called deaneries anymore, but that's the old term. And they make the educational decision, but obviously the employing trust as well will also have a view, though they tend to be in alignment, particularly if you can give a reasonable amount of notice. Next slide, please. So reasons to apply have expanded. I mean, the traditional ones were for health reasons or for caring responsibilities, but I think there's a recognition these days that many of us want to work LTFT for a variety of reasons, whether it be personal and professional development, whether it be around our welfare and just reducing the chances of burnout, which we're more and more aware is an issue, or, you know, to develop other aspects of your life. And just to develop a broad career portfolio, which many, many more of us are doing these days. So have a think. There's lots of good reasons. Next slide, please. For those of you who weren't sure how it goes about, you visit your local HEE or equivalent area website, and there's all the information you need on there. I work in the East Midlands Deanery, so I've used mine as an example, but there's the form that you fill in around changing your percentage, whether you want to go down or up. The other useful things you'll find on there, there's lots of guidance, but that's where you'll find your local calculator, which is what you have to fill in to show when your CCT date will be or your end of training stage will be. And that's a sort of live document that you work on and you submit. And obviously you redo it each time you have a period of time off or you change your percentage. Next slide, please. There's lots of information out there. One of my ST doctor colleagues is currently working on revamping a lot of these resources, but the college has lots of useful information, and that's the link for it there, and you'll see the categories we give you information on. So that's a good starting point. Next slide, please. When you need to know more about things like pay, rotas, all those practical employment side of things, the BMA is often a good starting point. And that's the link there. And they've got videos on there as well, and lots of other useful resources. Things like calculating rotas can cause horrendous complications if you don't know what you're doing. So have a look there and see what's on there. Next slide, please. I hope people who work LTFT, or indeed everybody actually, is aware that each hospital trust should have an LTFT champion. Their role is to do support, signposting, develop LTFT opportunities within the trust, and they should link in with things like your Junior Doctors Forum and your local negotiating committee, your LNC, to provide help and guidance, and they should be a really good source of support for you. Next slide, please. This is a programme that's currently in England, but I'm hoping equivalents will be available in the other 3 nations. If you take a period of time out of training, 3 months or more, you should think about engaging with the support programme. That's a whole system around planning your time before you go off, phased return if needed, support around returning, guidance and support to get you back up to speed so that you don't feel, you know, I've lost confidence because I've been off for a period of time. And it's a really, really valuable programme. You should also have a support champion in your trust, and many deaneries also have them now. So don't miss out on that. What we're finding is that sometimes trainees know about it, but for example, trusts or deaneries aren't quite so up to speed. So there can need to be a bit of reverse mentoring, but the message is getting out there. Next slide, please. So what does come next? Well, one thing I've done since I've been the specialist advisor for the colleges, I've got to attend the Enhancing Junior Doctors Working Lives Committee. And it's very, very clear that flexibility in training and less than full-time training is very, very important as a focus for them. So there's lots of work going on there. So more and different strategies are coming online and will be coming online over the next few years. The college is currently revising its guidance around flexibility in training, because we know one of the big things for less than full-time trainees is about your training time and how that works, and trying to get reductions, you know, your CCT date brought forward in certain circumstances. So there's work going on around that. We're starting our first focus group next week, which I'm really excited about, where we're going to bring together trainees, trainers, representatives from the 4 nations to start thinking through LTFT issues in the context of psychiatry. And I'm sure there's many more things that I could tell you, but I haven't got time. I'm happy to try and answer questions, which I think will come up in the Q&A or the chat. And if anybody wants to get in touch with me, please email the college. I'd be more than happy to talk to you about LTFT issues. Thank you.
Thank you, Mary. That's really helpful. And I definitely think that less than full-time training is something that's affecting, and more and more trainees now. So next, I'd like to invite Kate Pickard, who's going to come and talk to us about e-learning, which is something we'll all be very interested in as people that need to pass exams. Thanks, Kate.
Absolutely, thank you. And I've got a set of slides as well. We'll just wait for those to come up. That's great, thank you. And hopefully that's it. Lovely, thank you very much. So let me just get in here. So yes, hello everybody, thank you very much for joining. Great to see so many people joined. My name is Kate Pickard, as you can see, and I'm the e-learning development manager at RCPsych. So I'm just going to talk to you for a few minutes about Trainees Online, which is also known as TRON, which is our revision tool designed to support those preparing to sit the MRC Psych Paper A exam. So TRON is free to access for anyone registered with the college as a trainee, member, affiliate, student associate or foundation doctor associate. All you need to do is create a free account in e-learning and or log on if you've already got an account, and the site will recognise your status automatically. So if you're already a member, it will pick that up when you log in. Anyone not registered with the college is required to pay a subscription, which is currently £58.30 for a year's access, which I think is very good value, considering all of the different modules and revision tools that you receive there. So the content is mapped to the Paper A syllabus, and the full mapping is available on the website. You can find that if you want to have a look. Modules are written by post-membership trainees and are also approved at various points throughout the production process by the exam panel before being signed off by them just before publication. So everything is reviewed by experts in the exams. So in 2023, we had 3,017 completions across 59 different modules. And for our non-Tron CPD modules, which I'm not going to go into today particularly, we had 33,300 certificates of completion between 2021 and June 2023. So logging into Tron also provides access to the British Association for Psychopharmacology, or BAP's online CPD resource, which you can log into free of charge. And next slide, please. So Tron is hosted on the college's e-learning hub. As mentioned before, all you have to do is log into the hub using your RCPsych details. It's a single sign-on, and you'll automatically have access to all of Tron's content. You can search through the catalogue using the selection tools available in the hub. So that could be content type, duration, category, or keyword. Or if you prefer, you can choose which modules to select by searching through the syllabus mapping and working through them in that way. The mapping can be found in the Tron support pages, and it's broken down into each area of the syllabus with links out to relevant modules for each of the topics. Once you've chosen a module, you just need to follow the steps to open the content and begin learning. Next slide, please. So the modules are built in our modern template. Everything was moved across from our old website to the new one a couple of years ago. So the new template is very engaging and attractive. The templates are fully responsive. There's built-in accessibility considerations as well. You can navigate through the modules using the menu on the left-hand side, as well as via previous and next buttons, which are at the bottom of the screen. So there's various ways that you can go through it. You can pick whichever sort of suits you. And you can work through at your own self-directed pace. And if you leave the page and you come back to it, it will save where you were, so you're not going to lose your place. All the modules contain a set of learning outcomes at the beginning to outline what you should know and what you should be able to do upon completion of the module. Next slide, please. So the modules include various different types of interactions to keep you engaged as you learn. So if you look at the example on this current slide, you can see it's got a click to reveal exercise where learners click on each of the labels and associated text appears to provide further detail for each item. So images, diagrams, videos and drag and drop exercises are also used within our content to give a bit more of a blended learning experience, and just to give, I mean, nobody wants to go through pages that are just text. So these really do help to learn and to retain your learning. Also included, there are recap questions at the, not just at the end, actually, throughout the module, at the end of each section, as well as a quiz at the end. And these all help to consolidate your learning. So a lot of these questions are going to be in the form of extended matching items, or EMQs, extended matching questions, or multiple choice questions. Next slide, please. So once you come to the end of a module and you've completed all of the sections, you'll be awarded an online badge, and that allows you to keep track of which modules you have completed. And you can always access those badges in the awards section of the website. There's a button there that you click on, and you can see not just the one that you're currently in or that you've just completed, but you can see all badges for any modules that you've completed. So it's a really useful way to keep track. Next slide, please. So along with the module content, we include a collated list of useful resources. So learners can continue their learning and revision after completing the module. And there are also pages for key reading, references, and any useful websites. We try not to have too many sort of LinkedIn references within the content itself, but instead sort of house those at the end, because that allows you to keep going through your learning without being distracted, but you've still got all of those resources to look at, either during, if you choose, or at the end of your learning. There are also take-home notes, which is a document containing all of the key takeaways from the module, and these are quite handy as a revision guide. Next slide, please. So elsewhere on the eLearning Hub, we also host CPD learning, which is a subscription-based e-learning primarily aimed at consultant psychiatrists based in the UK, although we do have international members as well, looking to complete CPD for the purposes of their revalidation. There are currently 208 published modules on the eLearning Hub, with 39 currently in production. Most recently published CPD content includes the Equity versus Equality podcast and its connected module, which is named Health Inequalities, and that was published just last week. Both of those are highly recommended. The podcast features Professor Sir Michael Marmot in discussion with Dr. Amrit Sakar. And we've also recently published Mental Health During the Perimenopause and Menopause, as well as the Self-Harm in Adolescence modules, parts 1 and 2. The consultants aren't the only subscribers. We also have trainees, GPs, mental health nurses, as well as psychiatrists working outside of the UK. Alongside this, we host a selection of free modules and podcasts that everyone has access to. You just need a college account in order to log in. And obviously for CPD there is, and for Tron there is a subscription fee, which we've already mentioned earlier. Included within this offering are topical podcasts and the module Mind Your Language, Effective Communication in Clinical Practice, which is on person-centered language. And that is available to help learners with the newer aspect of the curriculum. The Hub also hosts the Congress Webinar Library and the Neptune modules, which is a set of 7 modules that cover the management of harms resulting from the use of club drugs and novel psychoactive substances. And these are free to access for all. So you don't need a subscription for the Congress Webinar Library or the Neptune modules. And the final slide, please. So to sum up, Tron, Trainees Online, is hosted on the eLearning Hub. You can see the web address there at the foot of the slide, where you can find not only the modules, but also FAQs and support information, as well as the BOP link, should you wish to take advantage of this. If you have any questions, please don't hesitate to contact our team via email. You can email us at tron@rcpsych.ac.uk. You can see we've also got a Twitter handle there as well. And the website address is at the bottom. And that was it for me today. Please do feel free to enjoy that and drop us a line should you have any queries.
Thanks, Kate. We've got a video message from Catriona Grant, who is going to talk to us about special interest groups that are in the college.
Hello everyone, I'm here to talk to you about the special interest groups, or the SIGs, as you might know them better. So aside from our faculties, which represent the main specialties within psychiatry, the college also has 15 special interest groups, or SIGs, which provide a forum for members to come together in a particular area of psychiatry. Each SIG has an elected chair and finance officer, and they lead on key issues within psychiatry and mental health, such as diversity, marginalised groups, history, spirituality, and other far-reaching areas. So as I said, each special interest group has a chair and a finance officer, which both of those roles are elected within the college election cycle. And they also appoint more informal executive committees from amongst the membership, and there's often a PTC representative or another trainee who will sit on the SIG exec committee. So there are 15 SIGs. I'll quickly just run through them all. I'm afraid I don't have time to sort of touch on the detail of them too much, but we have the Adolescent Forensic Psychiatry SIG, the Evolutionary Psychiatry SIG, or EPSIG, Occupational Psychiatry, also known as OPSIG, the Rainbow SIG, which represents the interests of LGBTQ+ members and patients, the Transcultural SIG, the Arts Psychiatry, or ArtSig, History of Psychiatry, better known probably as HopSig, Philosophy SIG, the Spirituality SIG, Women and Mental Health SIG, or WIMSIG as it's known, Digital Psychiatry SIG, that's our newest SIG, it's only been going for a couple of years, but the membership's increasing very steadily on that one. Neurodevelopmental Psychiatry, the Private and Independent Practice SIG, or PIP-SIG, Sports and Exercise, or SEP-SIG, and Volunteering and International, also known as VIP-SIG. So the being a member of a SIG essentially means you're signed up to the mailing list, so you'll receive updates from the SIG. Sometimes the chair will write a blog. A few of the SIGs produce really high quality newsletters, which are on the website, but also shared via email. We also publicise SIG events that we have coming up. Most SIGs tend to do a couple of events a year. So signing up to be a member of the SIG and therefore part of the mailing list means you're kept up to date with various things going on, what the plans are, whether there's elections, all sorts of things. We run usually 2 events per SIG per year. There's usually a nice mix of having in-person and online events, so there's an opportunity for people to meet and network, get advice from colleagues at various stages of their careers, and also online events or shorter webinars sometimes, which is a lot easier for people when they're struggling to get the time off for events and things like that, and also means people don't have to travel, which is great. So it's nice to have a good mixture of both. We have drop-ins usually at our International Congress, so we're going to be announcing details of those in the next couple of months, but that's again a really nice informal way for you to speak to people who are on the exec committee and find out more about the work of the SIG, discuss overlapping areas of interest, etc. So yeah, that's a really lovely forum for it, with lots of our members all in the same place. So we'll be announcing details of that, those in the next couple of months. And a lot of our SIGs run annual prizes and competitions with cash prizes often. So we have the Digital SIG, they run a Petra Kucha presentation, an essay prize from the Evolutionary SIG, the History of Psychiatry SIG, HopSig have a new essay prize they're planning on launching this year. The OPSIG run a trainee poster prize competition, which coincides with their in-person event, which is happening in March this year. The Rainbow SIG launched an essay prize in memory of Professor Michael King. Last year was the first year they accepted entries, so the judging panel are reviewing the entries at the moment. Spirituality SIG essay prize, that's been going for a couple of decades now. It's a very well-established SIG and essay prize, and similarly they are reviewing the entries for this year's cohort at the moment. Sports and Exercise SIG also do a trainee poster prize competition, which coincides with their events. And the Volunteering and International SIG have an essay prize and video pitch prizes, where they encourage trainees to talk about experiences they have of volunteering with psychiatry. And last but not least, the annual essay prize from the WIMSIG. So these are all really popular prizes, and often come with a cash prize, sometimes also free entry to their events, sometimes an invitation to present or to write something for the newsletter. So they're a really great way of getting involved with the SIG. So how to join? It's very easy. You just need to log into the members area. If you can't find the right place to do it, you can just go to the special interest groups page on the website, and there's a button that says find out how to join SIGs. And then when you log into the members site, you can tick next to every SIG you'd like to be a member of. So I'd really encourage everyone to do that. And if you have any specific questions about SIGs or want to know a bit more, you can look on the college website, and also email me. I can be contacted on sigs@rcpsych.ac.uk. So please do get in touch if there's anything further you'd like to know. Thanks. Bye.
Thanks for that, Catriona, and we'll move swiftly on because we're tight on time, and I know that we'll all want to hear from the next presenter, who is Dr. Ian Hall, who is the Chief Examiner, so has lots of essential and useful information for us. Thanks, Ian.
Thanks very much for asking me to present. Yeah, so I'm the Chief Examiner at the college, so I'm a psychiatrist sort of in charge of the RCPsych exam, and we have a whole team of other psychiatrists involved, and also a big team at the college who work very hard to deliver exams for people. Maybe it's not something that you want to think about right at the start of training, but on the other hand, it probably does pay to do so. So I'm just going to run quite quickly through the exam structure, and obviously do put any questions in the chat or anything, and hopefully they will post the exam's website and our email address as well, to the exam's email address. So the MRC Psych examinations, it's a part of core psychiatric training, okay, and all core trainees should have access to an MRC Psych course, where hopefully that will cover both the sort of knowledge and theory of psychiatry and the sort of basic sciences that underpin it, but also address clinical skills, and hopefully using techniques like simulation as well, which is a really good way to develop clinical skills. So it's part of the assessment program, but there's also a program of formative assessment, which hopefully you've heard about. So that's things like workplace-based assessments and your portfolio and your ARCPs. But the exam is the summative assessment. So it just means it's an exam, really. And that's required to enter higher specialist training in psychiatry. So in one of the psychiatric subspecialties, the second 3 years. So we have 2 theory papers, paper A, which is the basic sciences, the scientific base of psychiatry. So any fully registered medical practitioner can enter. So a few of you may have done this in foundation, but others may well not. Most people do it when they're in core training. And then paper B is about clinical topics. And also we have a critical review, which is a section which is about a third of that paper, which is looking at studies and research methodology and that sort of thing. And to do that, you should be on a psychiatric training program, and we recommend you take that after about 12 months in psychiatry. Both those papers have 150 multiple choice questions, which you do in 3 hours. And then we have a clinical exam, which you take after you've passed paper A and paper B, and we call that the CASC, which stands for Clinical Assessment of Skills and Competencies. That's a 16-station OSCE exam. I think most of you will have done OSCEs before, certainly they're done in all UK medical schools. If you haven't done OSCEs before, it's definitely worth finding out what they are and how they work and everything, and practicing them beforehand. So we assess 4 main clinical skills in these in the CASC. That's history, examination, so that's mental state, physical, management, and we also assess communication in every station. You can do this after 23 months training, post-foundation training in psychiatry. And definitely, I just would emphasize that any opportunities for simulation training, clinical skills training, were, in your first couple of years, I would definitely take up, because it's a really good prep for this CASC exam. We have a lot of information on the website about exams, so please do take a look at that, about when you can take it, how to apply, preparing for exams, and so on. So in Prepare, we have different preparing for exams, we have different sections on the different aspects of the exam. We are, so that points you towards some resources. I know we just heard about Tron, which is basically a resource for paper A. There's a college textbook actually about the CASC, and we're just at the moment actually reviewing our reading lists for resources for the written papers, so they should be up soon. And then in terms of the exam process, we really try and make the exam as fair as possible. The exams, of course, discriminate, but we just want them to discriminate on the thing that we're testing, so the knowledge or the skills that we're testing. We don't want them to discriminate in any other way. So we do a lot of work to make sure we're applying the right standard, we're applying it fairly, people aren't cheating, people who need reasonable adjustments. So the common list is for dyslexia, for example, that they get those. Addressing differential attainment is another important issue. So that's actually well worth looking at as well, those fair exam pages. The theory papers are delivered with computer-based testing. So mostly people are taking this in Pearson VUE exam centres. 1 or 2 people take it at home because of reasonable adjustments, but most people take it in Pearson VUE who have centres all over the world. This is just an example. This is a sample exam which is on the website of how it looks. This is an example of one of our critical review questions. So that's like interpreting data. We're also developing and have been piloting another style of question, which we call very short answer questions. So these are questions where we don't give you any answers to choose from. You have to do a free text answer. So these are reduced queuing because we don't tell you the answers, but it makes it much easier to test core knowledge. It makes it much easier to test more basic knowledge, which is important. So we're continuing to pilot those, but they're not in the exam at the moment. But we think these have actually a greater base validity and also encourage a better learning style as well. This is a bit of a summary of our CASC syllabus. So in those 4 areas I mentioned, it tells you that it sort of divides those up into the different aspects of those skills that we particularly look to test. And we say in our blueprint how often we sample all these. So these are going to be tested in most iterations of the exam. We also have video resources about the CASC, so just some sample stations. This is still from one of those. And just this is our exam venue in Sheffield where we do the CASC. So in the pandemic, we actually moved the CASC online, but after a very thorough review, we actually were convinced that that we need to go back to a face-to-face exam because this is a much better test of clinical skills and tests it in a much more holistic way and enables us to test a bigger variety of skills as well. So that's our UK centre for the CASC, and we're also developing some international centres as well. This is what it looks like. We hold it in a big sports hall. If you've done OSCEs before, you'll be familiar with like a circuit here of 8 stations. So people do 8 stations in the morning and 8 stations in the afternoon. I think that is all I wanted to say, but I'm very happy to answer any questions. We probably haven't got time to do any live, so if you put them in the Q&A, I'm more than happy to have it up.
So now we've heard about exams, we're going to hear from Fiona Watson, who's from the library, who might give us some tips about how to use the library potentially to revise for those exams. Thanks, Fiona.
Hi everyone, and I'm going to be sharing my screen for some of this time, so if you can't see it, please shout. Okay, so let's get started. I'm the librarian at the Royal College of Psychiatrists, and I'm available to help throughout your career. So that's beginning obviously as a trainee, or some of you may even have been in contact already as a student. But yes, before that, I just wanted to go through, we sort of have 2 aspects to the library. One is the physical library. You can see some of that behind me. We've recently had a donation of quite a lot of books from the old Broadmoor Library. So if anyone's interested in sort of history, stuff like that, please do get in touch. We've got some really interesting books here if you do want to have a look. We also have books to borrow. So that includes the exam books. Our most borrowed book is definitely the Maudsley Guide to the CASC, as you're probably not surprised to hear. We also have the whole college seminar series, which I hear are very good revision materials as well. Don't be put off by the fact that they seem to be for higher training. They're not. You're welcome to borrow. We send things out in the post. Don't think you have to be in London in order to do this. As long as you're in the UK, we'll send them to you, but you're responsible for sending them back again. But what we mostly do is provide access to online resources, and that's what I'm going to share my screen now and show you how that works. So hopefully you can now see my screen, and the easiest way to find the library online is just to Google RCPsych library. It's slightly well buried in our website. On Google, we should pop straight up. Access to all the online resources is through an RCPsych Athens account. If you'd like an Athens account, I'm going to share my email address in the chat. Just drop me an email. It only takes me a couple of minutes to set you up, and then you're good to go. And then once you're looking for the online stuff, it's all under access journals and databases. If you did want to check the library catalogue, that's all online as well, but this is for the online content. And you can see here, we also have an online version of the Maudsley Guide to the CASC. So if you want to read the ebook, that's fine. You can do that with your Athens account. Probably a lot of you have NHS Athens accounts. If you do, that's fine. You can have both. Just be careful that you log into the right one. So yeah, you can browse through our ebook collection. We have over 30,000 ebooks, which you're welcome to have a look through. We have a lot of journals like the Lancet Guide, the Lancet Psychiatry. We've got all the college journals through here as well. So if you're looking, that may be the easiest way to get to them. We've also got 3 of the major databases. I help members, including trainees, with literature reviews. If there's a topic you want to see some papers on and you're not feeling too confident about doing the searching yourself, that's fine. I can either give you some training or I can run some articles off and send them to you. I will also add that a lot of trainees seem to get involved in doing systematic reviews. I can also help with systematic reviews, but that is sort of a longer, more in-depth process. So for that, I would have a meeting with you and chat about it, talk about your search strategy, all that kind of thing. Yeah. Unless anyone has any specific questions or Laura wants to prompt me with anything that I have quite clearly forgotten to say, I think that's a brief introduction to the library. I'd just love it if you got in touch and asked for more details, if that sounds like it might be useful to you.
Thanks so much, Fiona. And yeah, definitely get in touch with Fiona, because the library can be a super useful kind of place to look for all sorts of things, not just exams, but I know that will be the focus of much of our training over the next few years. So thank you, Fiona. So I'll pass on now for our final bit with Dr. Indira Vinjamuri, who is the Associate Dean for Curricula and Assessment, and she's going to talk to us a bit more about the curriculum and what we'll need to know as psychiatrists. So thank you, Indira.
Thank you, Laura. I will try and finish on time. Hi, everyone, and welcome to the Psychiatric CT training. It's a very small cohort in February, so please make sure you're all buddied up with somebody who knows the system a little bit and can support you. So I'm the Associate Dean at the college, and I'm just going to give you a brief outline of things you need to know with respect to the curricula and the portfolio. For people who may have used certain other curricula in the past, there might be small differences. For people who haven't used curricula in the past, please take note, and there might be a little bit of quick learning to do. Local Trust may put up various sessions about how you do your portfolio and look at curricula, so please watch out for those. Next slide, please. So we follow the generic professional capabilities for GMC. These are the capabilities for GMC. Next slide, please. You'll see how we have mapped the RCPsych ones in the same 9 domains, and it might be useful for you to familiarize yourself with them. The college resource has just been put in the chat box, and please do make yourself aware of where this is. And as and when you have a question, it might be useful to just jump up to the website and have a look at whatever you need to find. It might be very difficult to remember everything in the beginning, but soon you'll get used to where to find the information. Next slide, please. So the GMC 9 domains, we've basically split some of them into further subdivisions to make it easier. Next slide, please. So that shows the subdivisions there. I don't think we have time to go through all of them, but please do have a look. We assess a whole range of clinical skills, as well as communication skills and management and teaching skills, research audit skills, and you name it. Literally everything is covered in the curriculum. But you will have all your 3 years to achieve all of them. Next slide, please. So there is a Psychiatry Silver Guide online as well. Please do have a look at it, and it has many, many questions that you might have that you find easy answers to. The core, specialty, and subspecialty curricula all look pretty similar, and they're all listed there as well. We'll speak in a moment a bit more about a placement-specific PDP. For those of you starting your course and settling in, you may need to speak to your clinical supervisor to start a PDP, to think about what you need to achieve in this particular post. And the placement-specific PDP particularly refers to what you might achieve in that particular placement that you're in your 6 months. We have put in ARCP decision aids, which you might need to just double check before you finish your placement and go to your ARCP. And there's also a document, you might go backwards, having a look at the end of placement expectations first, which might tell you where you need to be at the end of that placement so that you can make your PDPs a bit more specific. Workplace-based assessments are on Portfolio Online, and you will be doing assessments throughout your placement in psychiatry. Next slide, please. So just reiterating a couple of these things. These are all the documents that you might have to have a look at. And I don't think we have time to go through all of them, but the Silver Guide will give you the details to those. Next slide, please. So the curricula, the high-level objectives have all got some themes, and whenever you make your placement-specific PDP, you may be able to choose from which of those you want to achieve in each of those posts, and all the details are available on the Curricula Implementation Hub for you to have a look at. Next slide, please. So the key capabilities are listed against each of the HLOs, and we often get asked the question, how soon can somebody achieve all the key capabilities? Do you need to achieve all of them? The idea is that you should be expected to achieve all of them, hopefully by the end of your 3 years in core training. Next slide, please. So some of these HLOs hopefully will be covered every year. For example, professional skills, and then communication skills, clinical skills, etc. But something like research and scholarship and teaching and things, you may not have to do every year, but you may need to achieve some competence in these, and have a look at the end of placement expectations, and you'll get an idea from that. Next slide, please. So we mentioned a little bit about placement-specific PDP, so it's a bit tailor-made to your needs. Next slide, please. There's a video online, and links are posted for you, where we have a trainee and a trainer discussing how to do a PSPDP. Please do have a look. There's a link coming up as well on the slides as to an e-learning module, which will have links to all of these videos, which should be very useful for you to go through in the beginning before you start to do your PDPs. Next slide, please. Try and get your PDP done as soon as you can in the placement, so that you can start to then get through whatever it is you want to get through in the placement, and don't leave it too late. So you will need to see your clinical supervisor to get these done, and then meet up with your educational supervisor as well to double check that everything is in place. Next slide, please. You must have regular reviews. There is a possibility of adding in PDPs as you go along. Let's say there's an opportunity to do an audit or a quality improvement project in the placement that you didn't initially capture on your PDP. It's possible to include that in the end, or in the middle, and then review it in the end. Next slide, please. So we spoke about the examples of what CTs need to achieve. There are statements out there that you can have a look at, and this would give you an idea of what the expectation is for you to have achieved at the end of each placement. Next slide, please. So try and go through the e-learning package. Try and get through your PSPDP as soon as you can. And the PSPDP will need consistent work throughout the placement for you to have achieved it towards the end. Workplace-based assessments, they're not defined in any manner, and you would be expected to undertake workplace-based assessment throughout your placement. Please don't leave it for the end. And for those who may be able to do any special interest sessions, which is mostly the higher trainees, they're now called professional development sessions. So another word to be aware of. Next slide, please. So there's loads and loads of information on the college website. So if you go into training and then go into document and resources, you'll find examples and the e-learning package as well, which hopefully will give you lots of information that you need. Next slide, please. That should be the end, I think. I'm not sure we have time for questions. So good luck, everybody. And thank you, Laura.
Thank you so much. That was really helpful. And those top tips are definitely worth having a look back at the recording and taking note of. Yeah, so thank you to everybody for coming today. I know it was a bit of a whistle-stop tour through everything, but you can find out more information on all of those links that have been put in the chat, or just have a look at the college website, and there's lots of information. So once again, welcome to Core Training, and good luck and stay in touch. So thanks all for coming. Bye.